What is this? What kind of virus is there? RNA virus or DNA virus? Please comment RNA virus or DNA virus. RNA virus. So there is a reverse transcriptase. Reverse transcriptase for converting RNA to DNA. So there is a reverse transcriptase for converting this RNA to DNA. And there are other enzymes, integrase protease. These are the enzymes. Reverse transcriptase which convert RNA to DNA, integrase protease. This HIV virus has different genes, YAG gene, Pol gene, NV gene, etc. These enzymes are produced by Pol gene, YAG gene, Pol gene, NV gene. Pol gene produces this enzyme, reverse transcriptase, protease, integrase, etc. Then there is RNA. Then there are caspid is there. The caspid protein is known as P24 protein, P24 caspid protein, P24 caspid protein. This P24 is commonly used in detecting HIV virus. This ELISA and all uses P24 caspid. Then there is a matrix protein, P70 matrix protein, the P24 caspid protein, P70 matrix protein. Then there is a nucleocaspid protein, P7P9. Nucleocaspid protein, P7 and P9. Most commonly used antigen P24 caspid protein and P70 matrix protein. These components like P24 caspid protein, P70 matrix protein, nucleocaspid protein, P7P9, all are coded by the YAG gene. Okay. Then it's an enveloped virus. It has got a lipoprotein envelope. Okay, lipoprotein enveloped virus. Then what are these spikes? There are two things that are GP120 and GP41. These spikes GP120 and GP41. These are coded by the NV gene. So Pol gene codes for integrase, protease, reverse transcriptase, etc. It converts RNA to DNA. Then the nucleocaspid protein P7P9, caspid protein P24 and most commonly used, and P70 matrix protein. All these are coded by the GAG gene. The NV gene codes for GP160, which is split into this GP120. It is cleaved in the endoplasmic reticulum, GP160, which is the GP116 is formed by the NV gene, coded by the NV gene, which is cleaved in the endoplasmic reticulum to GP120 and GP41. This is very important when we see the pathology of the HIV infection. Okay. Let us see how the HIV attacks the T cells. Okay. There are two kinds of strains, R5 strain and X4 strain. Let us see what are they. The HIV binds the CD4 molecule. Okay. This GP120, this spikes we have seen, GP120. This GP120 can bind to the CD4. Look, GP120 has come bound to CD4. After binding to CD4, it causes the conformational change. GP120 has bind to CD4, conformational changes has induced in it so that it can bind the chemokine receptor. So this chemokine receptor play an important role in HIV infection. There are two chemokine receptors, CXCR4 and CCR5. If it uses CCR5 chemokine receptor, it is called R5 strain. If it uses CXCR4 chemokine receptor, R4 strain. Okay, CXCR4, R4, and R5 is X4 strain. X4 strain uses CXCR4 and R5 strain uses CCR5. R5 strain uses CCR5 chemokine receptor, X4 CXCR4. So CD4 GP120 has bound to the CD4, conformational changes is there so that it can bind to the chemokine receptor. So once it has its RNA into the cell, so GP120 binds to CD4, conformational change so that it can bind the chemokine receptor. This leads to fusion of GP41 with the cell membrane and insertion of the DNA components. Some percentage, 1% or some of the Americans do not have both copies of CCR5. So even if this GP120 has bind to CD4, after conformational chain, they have to bind to the CCR5 or CCR4. They have both the defective copies of CCR5. There is no CCR5, so they are immune to HIV. Okay. So okay, that one that is both defective copies of CCR5. HIV affects CD4 cells by which protein? Comment answer. HIV affects CD4 cells by which protein? Yes, A, GP120. GP120 binds to CD4 conformational change, so that binds CXCR4 or CCR5. Then GP41 is inserted and DNA is inserted. Okay. These R5 strain predominantly infects the monocytes. Okay. Initially, most of these HIV virus are R5 strains, so infects monocytes. But after gaining entry to the body, they change to the X4 strain, CXCR4, so that they can bind the T cells and all mainly. So R5 strain and X4 strain is there. Again, about the clinical manifestation, all the details learn about in medicine also. Okay. Most common vascular tumor in AIDS patient. It is Kaposi sarcoma. Kaposi sarcoma is a special kind of vascular tumor found in AIDS patient. So these endothelial cells there is immune deficiency, so that these endothelial cells get infected by a particular virus, Kaposi sarcoma virus, which is otherwise called, which other name for this is human herpes virus 8. Okay, human herpes virus 8 can infect the endothelial cells and leads to liberation of certain molecules, novel inhibitors of P53, viral homologue of cyclin D. So these endothelial cells get infected with herpes virus 8, leads to release of these molecules. We know novel inhibitor of P53. We know P53 is a tumor suppressor gene. Okay, it suppresses the cyclin D CDK4 complex. Even if the cyclin D CDK4 complex is suppressed, then it cannot bind RB and liberate C2F. So there is increased cell division. Inhibitor of P53. Then viral homologue of cyclin D. So this can lead to Kaposi sarcoma. AIDS patient, HHV8 infection, Kaposi sarcoma. Okay. Then we can learn